morning, everybody, and welcome to Up Missoula. I'm your host, Scott Ramph. Again, I'm isolated in my house. I'm here to talk to you guys about the news, a couple things that's happening, a couple lighthearted things to keep you guys busy within inside and whatnot. So I'm going to tell you a little thing about what's happening within the news. I'm going to have a pre-critic fun video for you guys, but I also have a lot of news in Missoula about how you can get services if you may have coronavirus and you want to get it tested. Missoula has set up a drive-through testing thing here in the city of Missoula. One of the big things they want you to do is that you want to have a referral, which means you have to call their number, 258-INFO, otherwise known as 258-4636, and it is a great resource for anybody out there who may have been in contact with the coronavirus and wants to get tested. This test is really easy, streamlined. It's happening at the Missoula County Fairgrounds. They'll turn you away if you just go there willy-nilly. So you have to schedule an appointment and you have to talk to the people, and the big number that you have to call within the city of Missoula once again is the 406 number, 258-4636, otherwise known as 258-INFO. And that's basically what's happening within the city of Missoula. Of course, Montana, in terms of COVID-19 reported cases, there's 19 new cases reported. There's 354 confirmed cases of coronavirus in the state of Montana. Gallatin County now reports 128 cases, more than any other county in the state. There are currently 52 cases in Yellowstone County, 34 Flat County, and of course Missoula County is reporting 25 cases, including one COVID-19 reported death in Missoula. That happened over the weekend on Saturday. They have not released the name of the person so far. One of the biggest things that are happening in the nation as well is that New York is being hit the hardest with one of the biggest things that the governor of the state of New York, Anthony Cuomo, he says that that 799 people died on Thursday, one of the highest records. The new spike in deaths has pushed the total statewide toll over 7,000, about half the national total of deaths in the United States. And one of the biggest things that are happening within the world as well is that the U.S., a little bit of good news, which is still saying it's still not that great of a news, is that one of the task force representatives from the White House, Dr. Anthony Fauci, says that they're looking at more like 60,000 estimated deaths from the coronavirus rather than the 100 to 200,000 deaths that they previously mentioned as well. They're saying that this is going to be one of the hardest weeks within the coronavirus in the United States. And many officials, especially within the statistics out of the University of Washington, have stated that the peak is near and it will start going down, and we must stay strong and we must stay inside to keep a lid on the coronavirus from spreading. One of the big things about coronavirus is it's very tricky. One of the things, especially about coronavirus, is there is no immunity to it. It's easily spread, and it lasts on surfaces longer than you think. And a lot of times people contract it and can show no symptoms. And a lot of people are concerned about those specific people, which is why a lot of people who are not sick are frustrated with the idea of staying home, even though they're not sick. And so one of the things, of course, Missoula has done is with these drive-thrus, once again, it's 258-INFO for more information, and if you want to talk to a nurse, Missoula County health officials to talk about this as well. One of the things that MCPS has done is that they have utilized Zoom, which is an online source. I knew offhand that a school out of Russell was able to teach a class, and we're able to come together and have a teleconference classes. So a lot of the classes are kind of evolving within the city of Missoula as well. I know that my niece this afternoon, which I'm recording this on Thursday, she had another session with her school at Jeanette Rankin Elementary School, where they talked about this a little bit more, where they had a pilot class in the afternoon. It's just a lot of things that are kind of evolving. Last night, Wednesday night specifically, the teachers, they got in their cars and they drove the route of the bus route for the kids so they can wave at some of the kids as they drive by, just to kind of give solidarity to the isolation of some of the kids who are getting a little rambunctious. And of course, the city of Missoula has asked for people within the city of Missoula to use common sense. And if you guys do plan on going out, because it has been a really nice couple of days here in the city of Missoula, as spring has kind of sprung, but in Montana, spring actually sprunging isn't necessarily an actuality, because we always kind of dip back into winter a little bit. But it looks like this weekend's going to look pretty nice, so you guys can check out the weather as well by going online, checking your weather apps, all that stuff. But I'm going to wrap up the news and kind of what's happening today. I have a lot of stuff to talk about for City Council and more information about this new program that's going to have a nice drive-through coronavirus testing within this Missoula County. So stay with me there. But first, I'm going to show you some programs to keep you entertained this weekend as you go into Easter Sunday.
For most people, so Open Aid Alliance came up with this new program called Uncovery. It's a come as you are philosophy. It's not abstinent based, so people can continue using drugs while they're a part of the program. It also uses peer support counseling services in the same way that AA kind of does, with people who are recovered from addiction, counseling other people who are going through that same process. So this was a very important local public health experience for me.
And what we're asking for and what we've committed to as a community is replacing that natural gas and that thermal energy with more additional clean electricity. And in our region that mostly means solar. It could mean that we buy into some wind that's not right here, but it has to be additional. We don't want to just move the numbers around and say, well, here, I'll give you credit for this wind farm and that electricity, so that we're at 100%, but then somebody else's grid mix is now 30% or less. So it's a long story about how you do the math and how you crunch the numbers, but what we're asking for is new renewable energy, potentially paired with storage, all kinds of different ways that you could get that.
They focused on the black children who used racial epithets to refer to the dark-skinned dolls, expressed preference for the white-skinned dolls, and in some cases ran crying from the room when asked which of the dolls most resembled them. The legal team then argued that the tests revealed that prejudice, discrimination, and segregation fostered feelings of inferiority and damaged the self-esteem of African American children. Although not the only evidence that was brought forward about the negative effects of segregation, it proved to be one of the most salient, evocative, and ultimately convincing elements of the Brown legal team strategy.
So my children and I were able to build a home through the Mutual Self-Help Program with sweat equity. So for 14 months, I worked 40 hours a week in my job and 30 hours a week in the job site, plus I single-parented 2 teenagers. During that time, we had finally become the family I used to cry about in the window. There was no more grieving for normalcy. Having support, encouragement, and resources during my critical time of need was crucial to growing forward. Looking back, I cannot imagine how I would have done it without you, Kim. And the support from Word. I thank God you were in my life and that you sincerely cared about us. My story is just one of the countless women and families that they have helped over the 30 years Word has been in our community. The services they provide has proven positive results.
Hey guys, welcome back. Let's talk a little bit about some of the things that you guys can kind of entertain yourselves over the weekend. Like there's always, like, what I did with Pre-Critic is I'd always talk about movies that are coming out this weekend. There's not many movies coming out this weekend, and Hollywood is kind of pushing a lot of their dates 3-4 months in advance just so they can still make their hand over fist money, because they spend like hundreds of millions of dollars on these movies, so they want to make sure that they get the money rather than just dropping it on streaming services just so they can make more money out of it. So anyways, let's talk about one of the most recent drops to streaming services. It's called Coffee and Kareem. So it's not one of those great movies, because all the good movies are being pushed. All the kind of crappy throwaway movies are kind of being put to streaming. So Coffee and Kareem, from the makers of those kind of movies where, hey, you don't get along with your potential stepdad, but now you have to put him in a wacky situation, which where the stepdad must win over their girlfriend's kid, comes Coffee and Cream, a movie that really just dives into the world of street crime and kids swearing left and right as their mother becomes less and less attracted to the potential add-a-dad goals, but will completely forgive them because the kid finds out that the dad is kind of cool because he put him in risky situations in the first place, and the mom's like, okay, I guess that's okay, blah, 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 and then they kind of forget about the whole kind of major stakes things. And also the bad guy is always much like, it's like, oh, you got to get this kid within 24 hours to find them, and they're usually just like blank bad guy, and just be a finger twirling, nose mustache twirling bad guy. That's all you got to be. And then of course the good guy is like, I'm way over my head, and I don't just mean becoming a potential stepfather. So that's what you can expect from this movie. And let's talk about some other things. There's a couple shows, of course, I did suggest as well. One of the things I do suggest that is very staggering to today's times is Chernobyl. And if you haven't gotten a chance to see this, of course came out last year, 2019. It is Chernobyl, which is based in the 1980s nuclear plant meltdown. One of the big things about it is it kind of shows the heroes and the villains of the times, the Russian government trying to cover it up, but also not jumping to prevent this from spreading. And one of the things that are very staggering about it, as you watch it, you learn that a lot of people sacrifice their lives just to prevent this kind of disaster from destroying basically the world. And it's a very short miniseries, but it's totally worth it. Chernobyl, it's definitely one of those shows that you should totally check out. But if you're not interested in shows, you're not interested in movies, you're interested in probably 30, 40, 50-hour campaign games, well then the new Final Fantasy VII Remake just came out for you guys, from the makers of a game that will pretty much never stop making it's kind of like the whole kind of idea of like, it's the never-ending story, but they keep on making movies, and actually the story actually does end at the end of the movie. But anyways, Final Fantasy, it's the seventh, or actually maybe like the 16th, because it's a remake of the 7th of the blah, blah, blah. Anyways, this movie is a Japanese role-playing game, and it was so popular that it made very popular stuff happening within the Japanese culture, really embedding into society. One of the big things is that a corporation is using the soul of the planet to power their stuff. So it's basically like, it's not necessarily like the oil crisis, but it's more like an earth energy. So the whole kind of idea is that they're able to tap into a spiritual energy of the earth and then use it to power all the crap. And that's what the kind of the overlaying story is within the thing, as the guy just kind of, but of course you probably ignore the whole kind of major plot line as you're just spending 30, 40 hours on side quests to find lost kittens and stuff. Typical JRPG type gaming. But Final Fantasy VII is one of the greatest games that came out from Sony, and it's definitely worth checking out because Chapter 1 came out, and apparently that's supposed to be about 30 plus hours of gameplay, and then it's going to come out episodically, so because they want more money, and they're going to try, and they're going to get it, because it's one of those games that people are really excited about, and it plays pretty nice, I guess. So yeah, so enjoy some 6K, 8K type graphic games on your 4K TV. Alright, so that pretty much does it for all your games and all your stuff to entertain you while you guys are stuck inside, like me. But I have a fun dubbing stuff for you guys right now, and then when I come back, I'm going to be talking about some city council, so stay with me.
Science, I have entered. Please pay attention to me. A wise guy, huh? You dare not listen to your chieftain?
I'm terribly sorry, I have to concentrate on this thing. What can I do for you?
Really?
Sir, that's not a Fanta.
You wouldn't have it here if you didn't want people to touch it.
I know, but we're working with very volatile equipment here. That stuff is very dangerous.
Well, curiosity killed the cat, but his satisfaction brought it back.
That's a good one, sir. But when someone's doing science crap, you just can't put your hands in the crap.
Oh, well, fine then. I'll go listen to Hoopastink or whatever.
Well, there's no need. Here, let me show you something really cool. You'll be like, whoa, that's crazy.
Oh, geez, Doc, you really know how to make science fun.
Alright, you're gonna be really impressed with this. I'm talking without moving my mouth. It's great. It's
Will you
wonderful.
just get on with it already?
Okay. Kablammo!
Oh, whoa, that's crazy. Oh, whoa, that's great.
You see, with the right chemical reactions, you can have all sorts of great puffs of smoke and whatnot.
Wow. My dream of becoming a magician has come true.
Oh, run, run, run. Oh, run,
Hurry,
run,
they're catching
run.
up.
We have to get out of here.
Oh, is there a problem?
Maybe if we go this way. Yeah. Oh, great, that's right. There's a boulder here. We can move it. Oh my god, we gotta get out of here. Oh, come on,
You need to
guys.
calm down over there, okay? I told the government as soon as they opened up the doors to the stores, we'll be in a whole heap of mess.
Get out of here. Oh, God, look, they're coming. Oh, my God, we got it.
There's gotta be a faster way.
Oh, jeez. At this point, this is the only way.
All right,
Dog
we're
sounds.
getting it. Push. Push.
Toilet paper, non-essential items for cleaning. Ooh.
They're right there.
We can clearly hear them.
Can I return this item with our receipt?
One big push now. We got the fear in us.
Power of love.
Oh, jeez. I thought it would be easier when they open up the stores, but it just got a lot worse.
What do you expect? Customers are the absolute worst human beings of all time.
If you can consider them human beings in the first place. Oh!
Alright, that's enough. Those customers are the things that pay your guys' salaries, so you guys better be nice to them.
Whatever.
The customer's always right, damn it. Now I'm gonna go scout ahead. I'm gonna go call the offices and make sure they got plenty of toilet paper for next time.
Well, you know, the means of production haven't really stopped, so it kind of seems kind of pointless to buy out the stores.
Yeah, you would think, right?
All right, so the city council have not officially met. This was a COVID-19 briefing, and one of the biggest news that dropped was the testing kits and the drive-through testing that they're providing at the Missoula Fairgrounds. The city officials have met for another major update on Monday. Of course, many things are changing. There's a lot of fluid things happening within the news and testing and all that stuff. But of course, they've been talking about these on MCAT and online through the city of Missoula. And after the city council, I'm going to show you the most recent briefing of the COVID-19 deal. So I'll show you that at the very end, where you get to just have the most recent updated COVID deal before the afternoon, and then they'll have a brand new one. So you can subscribe to MCAT to find out more information about where you can get updated on your COVID and how your city of Missoula is working forward with this. But of course, part of Monday's meeting was the COVID-19 briefing. So this was a Missoula County press conference for the press to ask questions. Most of the time was spent as an informational deal for the city of Missoula. So most folks present were health officials and school officials from MCPS and University of Montana. President Seth Bodner. They're all via phone. The mayor of Missoula was there. You have Sydney Farr, who was also the incident commander for COVID-19 Missoula City County Health Department. She talked a little bit, but of course here's Mayor John Engen kicking off this meeting.
I recognize that people are going a little bit stir crazy, and I get that. But if you're on our trail system, if you're in our parks, if you're sharing space with your neighbors, you gotta maintain that social distance. Particularly if you're a young person and you feel invincible. It's been a long time since I felt invincible, but you ain't. And the folks you come in contact are not invincible either. So it's really important that you maintain that social spacing as well. I'm talking to you, skateboarders. I'm talking to folks who are playing on basketball courts. I get it, but please, please, please maintain that social distance and do your best to stay home if you can.
And so one of the biggest things that the mayor wanted to talk about was common sense. And of course, that was the biggest thing in the news this week, talking how people are still going out, people are complaining, and there's some issues kind of going back and forth with people not taking this as seriously as they should be. The mayor, of course, as recently was granted additional powers, which means that they don't necessarily have to have a quorum, and the city can still approve claims and move forward with that. So that means the city council doesn't have to vote on paying the bills to Northwestern Energy to power the lighting, the street districts, and paying the bills which the city pays for basically downtown life. And that's one of the things that the city wanted to change. And one of the big things that they're doing next Monday, hopefully, is they're trying to initialize a kind of a conference call video type deal where they're able to all meet up online, and MCAT will try to stream it as well, much like what MCAT already did before with MCPS, where they used a kind of like a group chat conference app, which allowed them to talk to each other and chime in. Of course, you don't have the interaction that you used to have, but it is what they considered a kind of a quasi-quorum, because they were all in attendance. You could see their faces as they were talking. So that's one of the things that they're moving forward with this as well. But let's talk a little bit more about this COVID briefing within the city council. Cindy Farr, the incident commander who is coordinating health officials to help people, are talking about a drive-through testing option that launched as of Tuesday of this week.
It is an appointment-based testing service. So the way it works is you call 258-INFO or 258-4636. You would be able to have a chance to talk with a nurse. As Mayor Engen just said, testing supplies are still limited. So right now we are limited to testing people that fall into the priority 1 and 2 categories that are listed out by the CDC. That includes people who are healthcare facility workers who are having symptoms, patients in long-term care with symptoms, patients 65 years of age and older with symptoms, patients with underlying health conditions such as cardiac conditions or respiratory conditions that put them at increased risk if they have symptoms, and also first responders who are having symptoms. We do anticipate that our supplies are going to start coming in a much more normal rate, that we will be able to get our hands on the supplies that we need, and as our supplies increase, our ability to test people who fall into the other priority areas will also increase. But for right now, because we are kind of sticking with that priority 1 and 2 testing groups, then it is important that people call and make an appointment through our 258-INFO line.
And like I said at the beginning of the show, one of the things that you need to remember is, I'm going to nail this number over and over again. It's 258-INFO, otherwise known as 258-4636, is the main number to call. You have to have a referral and you have to have an appointment. You don't have to have a specific time for appointment. The whole idea is that they want you to come in and out, and the sooner you are able to do this, the sooner you're able to go in and out. And most of this testing is about 6 to 10 minutes. It's really simple, really streamlined, and of course testing is limited, and Montana is starting to see federally funded tests coming in. Of course, last Thursday, so Monday, there was a phone call to President Donald Trump from Montana Governor Steve Bullock, and one of the things that they tried to do is, he just was like, we're running out of test kits and we need disaster relief. So Donald Trump, as of last Thursday, a couple days after the call with from Governor Steve Bullock out of the state of Montana, Thursday is when Trump declared Montana the state of emergency, and we are starting to see the federal money starting to trickle in as we're going forward with a lot of these testing kits that are available. But as always, they're still limited, and the Missoula City County Health Department are pulling money out of their resources to provide these test kits for people as well. Most of this meeting was informational, and they wanted to answer questions that the press might ask. This is Dr. Robert Stenger, the lead physician for Missoula City County Health Department, says this is not for emergency care. this drive-through is just for testing, and this is what he had to say.
Fairgrounds, we are really just doing testing. We are not set up to see people that are sick. So part of that call ahead and talk to a nurse on the phone is if you were sick, you're going to be in terms of like needing more medical evaluation, not just I have a fever, I have a cough, but if you're really having trouble breathing or coughing up blood or turning blue when you breathe, things like that, you're going to be directed someplace else in town where you can be evaluated. There are going to be some physicians out on site at the fairgrounds as part of the testing team, but their role is really going to be to support the team out there, and if somebody is showing up and needing more medical attention, to direct them to the right places in town to get that.
All right, so now back to Cindy Farr, the incident commander. She talks about a new CDC policy for you to protect yourselves, and this was as of Friday.
For people, if you are going to be out in a community setting and there's a chance that you're going to be within 6 feet of other people, particularly if you're going to be out in the grocery stores or the pharmacies where it's really hard to maintain that 6-foot distance at all times, that everyone should be wearing a cloth mask. We want to reiterate that it's important that you follow the guidance of wearing a cloth mask, and we're not talking about an N95 or a surgical mask, because we really do need to save those for our healthcare providers. But the reason that they made that recommendation is because of the idea that we could have pre-symptomatic spread, where for a couple of days before you actually start having symptoms of the disease, you could be contagious. And so with enough studies that have come out to show that that is possible, then the idea is if you are wearing a mask and you are contagious because you're within that couple of days before you know that you are having symptoms, that this will protect people around you from you giving it to them.
Part of this new policy is to keep you from spreading anything. Wear a face mask. COVID-19 is a very aggressive virus that has the ability to spread regardless of how the individual feels. The CDC says 3 days before symptom shows, there's a chance that COVID is contagious as well. A couple other issues Missoula County has been having is within this Missoula Parks and Recreation. Missoula Parks and Rec have officially closed their parks to the public, and but it's not easy to let people know because you cannot throw chains on jungle gyms. You can put up signs and stuff like that, but what they're trying to do is let people know is that you should use common sense, and you shouldn't be letting your kids go on the playgrounds. They don't clean the playgrounds. Just think about that. It's a huge, serious deal, and they want you to stay safe. If you go on trails, make sure you mind the gap between people. So if you see a group of people, just tell them to get a little more space. I know it's kind of hard to do that, but that's one of the things that city wants you to try to do, is that if you see people hanging out, make sure that they are keeping within the 6 feet distance apart. And plus with this whole new CDC thing, face mask, if you guys are planning on going to the grocery store, it is really hard to actually go to the grocery store and not follow the rules of being 6 feet within people, because people are passing back and forth. Wear a mask. It's not necessarily to prevent illness, but it's also to prevent spreading of germs, which some people might have the COVID virus without even knowing it. And a lot of workers, praise the workers as well, because they're staying working, service industry. Grocery workers especially are still doing their job diligently. A lot of them are wearing masks, covering their face, and just trying to prevent this, and having screens and protective walls. But it can only do so much, but you have to do your part as well. So finally, Corey Aldridge with Missoula Mountain Line talks about masks and what they are doing to continue service and provide a safe, healthy ride through the city of Missoula.
A matter of just trying to keep our operators safe and trying to work on that social distancing. Because even though our ridership is down considerably, there are still times where the buses, there are too many people in there. And so that's why we're going through altering our routes, getting rid of or stopping Route 1, and we're going to be taking that service and putting it onto Route 2 so we can increase that frequency since it's most heavily used, and hopefully create that social or physical distancing that's necessary.
And of course, if you couldn't hear that well, one of the things is that the Mountain Line will stop Route 1 Route 1 is one of the more major routes, but it's the one that goes to the university section as well. But one of the things is that they wanted to increase traffic on Route 2. They've been noticing a lot more people riding Route 2, so they're going to provide more buses so they can have more space between people for Route 2. So Route 2 is going to increase, while Mountain Line is going to stop Route number 1. And Route 1 is the one that usually goes through the university area as well. So Mountain Line will no longer be doing that in this temporary time. Cindy Farr talks about when Montana would peak, because that's the big thing in the nation, is that they're wondering when this is going to peak and when we're going to start seeing numbers going down. As of course, if you've seen the news, is that China is starting to open their country up once again for more business as usual kind of country, transportation, moving things around. So China has opened Wuhan, which has been known as the zero center of where COVID started, and the United States are kind of looking to them to see, like, okay, so this is where we might see ourselves in a couple months. So moving on, here's Cindy Farr talking about what the Montana would peak, which means we would start seeing a decline that we're hoping for.
So obviously, if we put all of these lockdown, stay-at-home orders into place and only half of our population is following it, then it's going to affect the ability to be able to predict when we're going to peak. And so right now, I think that we really don't know. We really don't know when our numbers are going to peak. I do think that we are a little bit behind a lot of other places, and it is an advantage to us here in public health and local government because it gives us an opportunity to learn from what they're doing and see what's working and what is not working, and if they've got good messaging and different habits that are slowing the spread that they can see are slowing the spread because they have so many more cases than we do. It's definitely an advantage to us. But at this time, I think it's just impossible to really predict exactly when we're going to see our peak. That's one thing about outbreaks and epidemics and pandemics is it's really easy to see where you peaked whenever you look in your rearview mirror and you're on the other end of it. It's really hard to predict because it's so much based on human behavior.
All right, so that's it for your city council. If you are interested in the state of Montana in terms of how we're combating the spread of COVID-19, then you can watch the rest of this meeting. This is provided on MCAT. This is at mcat.org. You can look at channel 190, and it is available online. I believe we posted these videos up on YouTube, but if you can't find it on YouTube, you can go to the Cities of Missoula's website, ci.missoula.mt.us. It is a wonderful resource for you guys to get in contact with the city of Missoula, but of course, the health officials ask that you call their number. Once again, the number is 258-INFO, otherwise known as 258-4636. And if you fear as though that you have the coronavirus and you want to get tested, call them at 258-INFO for more information about that. All right, so that pretty much does it for this and that. But for right now, I'm going to show you the most recent updated COVID-19 report from the Missoula County. And then when I come back, I'm going to start wrapping up my show. So stay with me.
Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 9th, and this is my daily briefing. And I'm just going to let you know up front, you might hear some background noise on this video. They're doing some construction on the street behind me, so I just want to apologize in advance if that's disruptive. So we currently have 26 cases in Missoula. There are 354 cases in the state of Montana. There have been 6 deaths in the state, with 1 in our county, and we've had 14 recoveries to date in Missoula. Today I just want to talk a little bit about enforcement. We've had several people reach out to us asking how the governor's orders and our local health department orders are being handled here in Missoula County. There's a sense that no one is enforcing things, and so we just want to make sure people understand that that's not true. The health department is charged with enforcing both the health officer's orders and the governor's directives to stay at home, only operate essential businesses, and quarantine for 14 days after travel out of the state. Inquiries and complaints are handled by our Environmental Health Division, and they've been very busy contacting businesses and individuals about complying with the orders and the directives. So when they get a complaint, they first reach out to the business or the individual, and they have a conversation about the order, why it's important, They talk about what needs to change. Often this is all that needs to happen, and both parties come away with just a better understanding of how to fulfill both the spirit and the intent of the orders and the specific requirements. Environmental health staff have found that most community members are willing to comply, and sometimes they just haven't thought about how the governor's directives actually apply to them. This last one is important as there are many rumors that are going around about tests and treatments. There's some clinical trials that are happening right now to look at pharmaceutical interventions, but none of them have been proven effective or safe for this application. The scammers and rumors of miracle cures are really dangerous, not just because these supposed treatments might not work, but some could actually be deadly. So taking things that haven't gone through the review and approval process or taking drugs without the supervision of a medical professional can be dangerous. We hope that ongoing research and innovation will provide more options for testing and treatment and prevention, but right now we just need to stick with the prevention behaviors that we know will work, like social distancing, staying at home, hand washing, and face coverings to prevent you from getting someone else sick. As always, it's important to just maintain all of those measures that we have put into place to help protect our community and protect your own loved ones. If you have any questions or you want to see if you are eligible to get tested through our drive-through testing facility, you can call 406-258-INFO. That's 406-258-4636. So thank you for everything you're doing out there in the community to help keep our communities safe and healthy, and I will talk to you again tomorrow.
All right, hey guys, welcome back. I just wanted to thank you guys for joining me as well. The city of Missoula, one of the big things that they're going to be working on is trying to provide a city council meeting, which will happen on Monday, April 13th at 7 p.m. The city is hoping to be able to have a quorum and be able to incorporate all the city council members and be able to have it online and have a video chat amongst themselves and be able to chat and talk about city policy and moving forward with a lot of stuff that's happening within the city of Missoula. And if you haven't already noticed, just a little kind of a side note is that a lot of construction still being done. One of the big things that they were doing is that they were stripping and repaving a lot of Higgins Avenue in the downtown Missoula area. It has seen better days, but downtown Missoula is looking much nicer, and hopefully we'll be able to be a little more accessible for people as well. I also noticed that the city of Missoula was also about to finish Russell Bridge. Russell Bridge is, if you've driven over Russell over the river, you can start seeing that the rest of the bridge is about to be completed. I'm sure they said exactly when it is, but I'm suggesting they probably will be done within the month of April. So guys can look forward to a much bigger bridge to go through Russell as well. But I don't know, there's not much else to say. Kind of gave you most of the updates, what's going on within the city of Missoula. I'll show you guys how the city kind of came together next week, talking more city council stuff. But like I said before, that the city councilors are doing a little less as well, so there's no committee meetings that they're attending. So the month of April, the governor of the Montana has also mentioned that schools will still be closed until April 24th. Many people are also speculating that they might extend it a little bit further beyond that, because just because we peaked doesn't mean that we're not going to have a second coming of the coronavirus with new cases and new symptoms. Part of this isolation is just because you start seeing the cases go down doesn't mean it's time to stop, because there's a whole bunch of opportunities to have more coronavirus, and that's one of the big things that you have to remember. There's just a lot going on. And you guys can find out more information about MCAT and what's going on with us at MCAT.org. And like I've said a couple times before, is that MCAT is closed. We will be opening within the new library at the mid-May. Is by the time MCAT's going to be start moving into the new library. But as of April, we've been closed to the public, and we're just going to keep it that way. So our old location at 500 North Higgins Street 105, completely closed. And if you're interested in finding out more information, MCAT, you can still call MCAT and ask and just kind of ponder what MCAT's doing. We're still doing a lot of stuff within the community, trying to provide great programming like myself. But like I said, I just want to thank you guys for joining me and for working in Missoula. I'm Scott Ramph. Take care.